Hi, I'm Dr. Sheryl Ross. If you're thinking about getting pregnant, these are the top 4 things you should keep in mind. First, pre-planning is key. You want to plan to meet with your healthcare provider 3 to 6 months ahead of time to see if you and your partner are physically and mentally ready to have a healthy pregnancy. During this visit, a review of your medical and genetic history is important to make sure there aren't any red flags that can affect your pregnancy. It is also during this visit that you will be started on folic acid. We know the importance of taking folic acid 3 months before conception to reduce the incidence of spinal defects. There was a recent exciting study about folic acid, and it found that if you took folic acid 4 weeks before conception and up to 8 weeks into the pregnancy, that you had a 40% lower risk of giving birth to a child with autism. Number 2, it's all in the timing. Understanding when is the right time during the menstrual cycle to conceive is essential, and it's also the most confusing. On average, women have a period every 28 days. It is important to know when you ovulate. It is during this 24-hour window that the egg is available for the sperm to fertilize. This is what we will call timed intercourse. Typically, it's around day 14 that you will ovulate. Now, some women will notice an egg white and slimy discharge around the time of ovulation, and others will actually notice a twinge or a slight pelvic discomfort. You can also detect ovulation with an over-the-counter ovulation predictor kit or getting a fertility app. Once you've identified ovulation, you can have timed intercourse and be efficient at having sex at the exact time of the month that the sperm and the egg can form an embryo. Number 3, patience is a virtue. Each month, you have a 15 to 25% chance of conceiving with timed intercourse. It may take an average of 6 to 9 months to conceive depending on your age. 75% of couples will have conceived after timed intercourse for 6 months. After 12 months of having timed intercourse, approximately 90% of couples will have conceived. The incidence of infertility in the United States is roughly 10%. The 4th point that I want to bring up is infertility. Who makes up that 10% of couples that are infertile? Now, this is the category that terrifies my patients the most. Women, or the female factor, causes infertility in 30% of the cases. Typical causes are related to failure to ovulate, endometriosis, and tubal disease. Men, or the male factor infertility, accounts for 30% of the cases and is mainly due to abnormal sperm. Another 30% represents a combination of both female and male factors. And finally, the last 10% have no explanation of why the couple is infertile. Now, for the other 90% with a positive pregnancy test, it's time to follow up with your healthcare provider and begin the miraculous journey called pregnancy.